Staten Islander News is here with Dr. George Fernaine, a cardiologist at NYU Langone. Dr. Fernaine is a cardiologist. He was influenced by his father, who was also a cardiologist, to study medicine. Dr. Fernaine started out with the ambulance corps as an emergency medical technician. He chose to become a cardiologist because he enjoys building relationships with multiple generations of families and helping people when they are most in need of a doctor. The field of cardiology allows him to provide care in both outpatient settings and in the hospital. Dr. Fernaine advocates for lifestyle changes for his patients to help them on their journey to regain health. As the section chief of cardiology at NYU Langone, Brooklyn, Dr. Fernaine is here today during the American Heart Association's American Heart Health Month to discuss heart disease, which is the leading cause of death for Americans of every gender, race, and ethnicity. Good morning, Dr. Fernaine.
Good morning. How are you?
I'm good, thank you. So the first question that we had is, what exactly is meant by cardiovascular disease?
So cardiovascular disease is any disease that starts affecting the blood vessels of the body, starts building up sort of plaque and blockages that would decrease blood flow to a vital organ. For example, the heart, which would lead to a heart attack.
Okay. Have you been seeing an increase in the incidence of heart disease in your own practice or hospital?
Anecdotally, yes, I have been seeing an increase, especially after the sort of the downtrend of the pandemic, as people started coming back to see doctors on a more regular basis. You know, that sedentary lifestyle over the last 2 years and the lack of follow-up, I think, made a lot of people's diseases progress. And also I've been seeing younger patients as well with cardiac disease, and most likely related to that, sort of that unhealthy lifestyle for the last 2 years.
Okay. Do you have any theories for why heart disease is so prevalent, or why it has long been the leading cause of death in the U.S.?
I think a lot of it has to do with lifestyle and diet. You know, the things that affect the heart, you know, other than poor exercise, overweight, you know, is high blood pressure, high cholesterol, diabetes, smoking. All of these things are related, and all of them are pretty prevalent in the United States. So it's not surprising that, you know, you have 2 or 3 of these risk factors that you'll have a higher incidence of heart disease and strokes and things that would equate to cardiovascular disease.
Okay, all right, thank you so much. Have you heard about the spikes in heart attacks during each wave of the pandemic? And are you concerned that recent downward trends over the last decades in heart attacks may be reversing due to COVID-19 or some other unknown factor?
I hope not. I think, you know, COVID is still very new. I think that there's a lot of research that still needs to be done. There's many years of observation that are required to really understand how it's going to affect people in the long term. Definitely, COVID does cause heart conditions, heart attacks, but I'm not sure it's the heart attack that necessarily a layperson would think of as in, you know, a buildup of plaque and cholesterol that would close an artery that would close a heart and cause a heart attack. It may be related more to the development of blood clots. So I think it's a little too early to tell, but I'm hopeful that people are, you know, just going to try to stay healthy and stay ahead of it. Mm-hmm. And our researchers are working really hard on trying to figure out what the long-term effects are. So I think there's more to come in the next few years.
Okay, great. Now, how does heart disease actually develop for most people who get it?
It's multifactorial, right? It has to do with some of the risk factors, like I mentioned before. So people who have diabetes, high blood pressure, high cholesterol. obesity. There's definitely a genetic component. So if you have family members with heart disease, you are more likely to have it yourself. And that puts stress on the arteries of the body
Okay.
and builds up cholesterol and sort of fat in the walls of the artery that then slowly start encroaching into the artery. And basically, you could think of it as a pipe in your home and a sewage pipe, and you just develop all this crud inside, and eventually nothing's going to get through. And that's sort of like a very sort of simplistic way of looking at it, right? You want to try to keep those pipes clean, and you can prevent, you know, being overweight by exercising, cholesterol by eating right and taking the medications that your doctor can prescribe. What you can't prevent is your genetics. What you can't prevent is getting older. If anybody can figure that out, that would be great. But if you try to take away less, if you think about it as controlling more risk factors, then you're probably gonna do much better in the long term, as opposed to not controlling any risk factors.
Okay, that makes sense. How are strokes related to heart disease?
It's all part of the same sort of disease process, right? The brain is fueled by blood that goes through blood vessels, just as the heart is. And those blood vessels can develop, plaque buildup, cholesterol buildup. They get strained because of high blood pressure. So they're all interrelated. If you have heart disease, you're more likely to have, some kind of chance or risk for stroke, or a risk for even peripheral arterial disease, which is disease of the arteries in the leg, and vice versa. So once you have one, you need to really pay attention to the other areas. But for the most part, all of it is treated similarly, right? By controlling your risk factors.
Okay. So basically, you touched on this a little bit. Are there ways that people can improve their cardiovascular health and prevent heart disease? So you would say like reducing the risk factors. Are there like other things that they should add in rather than like exercising, stuff of that nature, or?
Absolutely. I think exercising is really important. And when we talk about exercising, we're really talking about cardiovascular fitness. I'm not talking about going to the gym and weightlifting, you know, because you weightlift 200 pounds versus 100 pounds does not make you a healthier person. It really is about getting your heart rate up and sustained at a higher level. Um, they say anywhere from 150 to 175 minutes a week. If you want to break it up to 30 minutes, 5 days a week, or something, some form of that, that's what you want to reach for. It's really the cardiovascular exercises that's important. And
Okay.
the other one is diet. Really paying attention to staying away from the red meats and the fried foods and the cheeses. Really concentrating more on your lean meats, maybe like fish, a skinless chicken, and I always tell my patients, if fish sticks don't count, right? You can't deep fry them. You can't deep fry your fish or get fried chicken. It's really got to be baked or broiled, healthy, and then the vegetables, of course, right? Your broccolis, your kales, um, your quote unquote super, foods that have a lot of vitamins and minerals that are helpful.
Okay, that makes sense. So if someone has been diagnosed with cardiovascular disease, what does that usually mean, and what do you recommend for such patients?
It could be a myriad of things. It could be as bad as someone who has just had a heart attack or a stroke, God forbid, or um, being diagnosed for the first time with high cholesterol or high blood pressure. So it's a very wide spectrum.
Okay.
But once that diagnosis is made, then I think it's important to really start following with a doctor on a regular basis, and more importantly, really changing your lifestyle. Lifestyle modification is very tough when you're older. It's not easy. We're sort of stuck in a rut, and we kind of have our own lives that we live in. I always tell my patients that if they have children or grandchildren, that's when to start, right? That's when, if you start teaching them about exercising and playing sports at a young age, about eating properly at a young age, those kind of habits stay for the rest of your life. My parents did not necessarily have that foresight, even though my father was a cardiologist.
Okay, that makes sense. So how is cardiovascular disease related to high blood pressure, or is high blood pressure just a component of cardiovascular disease?
So high blood pressure causes cardiovascular disease, and it's part of the spectrum of cardiovascular disease. One way to think about it is if your body is working against a higher pressure within your piping system, the plumbing system, the blood vessels, that pounding of the blood vessels can cause damage, right? So that's the way one way to think about it. So it causes cardiovascular disease, and it is a part of cardiovascular disease.
Okay. Now, is it known how smoking, like what the actual method that smoking increases the risk or prevalence of cardiovascular disease?
So it's multifactorial, right? So smoking actually can increase your blood pressure, which can cause cardiovascular disease. It also affects the lining of the arteries of the heart. It decreases its ability to vasodilate, or sort of the arteries to grow larger. It kind of constricts them and makes them tight. It kind of increases sort of the cells in the lining of the heart to develop plaque and blockages. So it is a multifactorial sort of trigger for a lot of problems in the body. So I definitely recommend, if the one thing that you can do if you're a smoker, if you can stop smoking, that is key.
Okay. So what is coronary artery disease, and does it always lead to health problems?
So coronary artery disease is part of that spectrum of cardiovascular disease. It just means that it's the arteries that feed the heart that are getting clogged, having cholesterol buildup, plaque buildup. Okay, and that's what leads to heart attacks. And it's important to understand that once you have coronary disease or any vascular disease like this, there is no cure. It's there. What medications and lifestyle modifications do is prevents rapid progression of that disease. So you hope that instead of having a major issue in 2 years or 3 years, that you have an issue in 30 years. So I think people need to understand that there's no cure, and that's why preventative medicine, preventative cardiology, reaching people at a young age, an earlier age, to prevent the beginning of this is so important.
Okay. Why do you believe that coronary artery disease is so prevalent? Is it back to the lifestyles that, like, everybody has all these fatty, fried foods and stuff like that, or is there something else?
I think it's a mix of things. Absolutely. It's the smoking, it's the exposure to tobacco. It is the fatty foods, it's the lack of exercise, genetics. And who knows, maybe, some viral illness could be a component of it. Hasn't been shown yet, but, the research is ongoing to see whether, COVID is part of that. I think you can only control what you can control. You can't control a virus, you can't control aging, you can't control genetics, but everything else, you really need to try to stay ahead of the curve.
And you've mentioned smoking a bunch of times. Do you still see a lot of smokers in your practice?
More than I care to, absolutely.
Oh, you do?
Yes.
Okay.
Yeah, it's much more prevalent than I thought
Okay.
would be.
Because I
it
thought it was
definitely.
like, most people don't smoke. You don't see it anymore. I mean, I guess they still do it in their houses or something like that.
Yeah, I just was speaking to one of my patients today, and she hides her cigarettes from her children in her mailbox.
Oh gosh, okay.
So, so people are closet smokers. They
Hmm.
know it's bad. It's become a stigma, which is great. I mean, it used to be in the films, everybody would smoke and it would be cool to smoke.
Hmm.
So I think things are changing. Um, Definitely when I speak to my children's ages, which are 8 and 9, and their friends, they're absolutely horrified by smoking. So
Hmm.
I think the next generation is even going to be better. So.
Okay. Oh, that makes sense. Okay. So, how is sleep related to cardiovascular disease? Like, why is sleep important?
Um, so the less sleep you get, the higher your blood pressure could be, the less ability of you to exercise could be. So it just adds to the sort of the risk of cardiovascular disease, right? Because it can cause other things. Uh, you know, they recommend 6, 7 hours of sleep a night, a little more if you can do it. Um, it's hard to do. It's hard to do,
Hmm.
especially the older you get. Um, and especially when you're working and trying to raise the family. But sleep is very, very important.
So, do you find that for when you were saying like the older you get, it's harder to get enough sleep? Is that because they're so busy, or is it an insomnia kind of thing? Like they
I
can't
think
fall
it
asleep?
depends on the age group. So for my age group, which I won't say, just take a guess based on how I look, it's because I work a lot.
Okay.
For the elderly, right? They tend to start sleeping earlier in the day and waking up earlier in the morning, but a lot of it, let's say, has to do because of aches and pains, like their joints hurt and they get up a lot at night, or they
Hmm.
need to pee in the middle of the night a couple of times. That disruptive sleep, that inability to get to a deep sleep has an effect.
Okay. So most people, particularly those over 60, do not get 7 hours of sleep each night. What would
Mhm.
you say to them to help them understand the importance of sleep for cardiovascular health?
I think that it would be important for them to understand that one, it can affect their blood pressure, and a lot of elderly people do have blood pressure issues, so that should be a motivator. Two, the more sleep that they get, the more energy they will have during the day. That more energy in the day will equate to being more active in the day. Being more active in the day would improve their overall health.
Okay. Um, so, how are superfoods such as salmon, nuts, and berries helpful for heart health? Are there specific nutrients they contain which have been shown to have beneficial effects on heart health?
Yeah, they say that there's omega-3 fatty acids that are very helpful in helping lower cholesterol. Vitamin B12 can help. A lot of the minerals in there that can help. I think you know these superfoods. What's most important is that they're not fried and they're not red meats,
Okay.
right? There isn't really a vegetable out there that's not good for you.
Right,
You know,
right. Okay.
some may have more nutrients than others, but overall, if you stick to vegetables and lean meats, you're ahead of the curve.
Okay. So, was there anything else that you would like to share?
I think the most important thing to understand is that it's never too late. Just start one day at a time, and eventually it'll become a habit. And more importantly, teach the younger generation
Okay.
because then they'll have the right habits from the beginning.
Okay, great. Well, it was really nice meeting with you, Dr. Fernaine, today. I appreciate your taking the time out of your schedule to meet with us. And I appreciate your time. Thank you so much.
No, my pleasure. Thank you.
Have a
Stay
great
safe.
day. You too.
Bye.
Bye bye.